Hey there, my name is Sarah. I'm a naturopathic doctor practicing in Toronto, Ontario, and today I'm going to be chatting with Hiraya Manawari. They recently graduated from naturopathic med school, actually the same naturopathic med school that I graduated from, and we'll be talking about his future in Nova Scotia, practicing as a naturopathic doctor. He's currently working toward getting registered to practice there. And today I just want to chat with they about the journey from being a nurse to becoming a naturopathic doctor. So I think that that's an interesting topic for many people who are interested in naturopathic medicine but aren't sure if they should transition from whatever job that they have. And Hiraya has successfully transitioned from becoming a nurse to soon to be naturopathic doctor. So just want to hear more about your journey. So thank you so much for being here.
Thanks so much, Sarah.
So yeah.
It almost feels kind of like so brand new to me, this title. I'm almost there. I just have a few more paperwork to do to get my license. But like hearing the word naturopathic doctor, all of a sudden I feel like a heavy burden or responsibility.
It is a huge responsibility.
It's like, you're a doctor.
It's massive. But you've had a lot of responsibility as a nurse too, though. So if you don't mind sharing, well, first of all, what got you into nursing?
Right.
Yeah, so go ahead.
Yeah, that's a loaded question. What got me into nursing? So I started nursing when I was 18, just right after high school. And at 18, I think all of us can agree that we don't really know what we're gonna do in life, right? So, coming from an Asian background, my parents decided they recommended certain avenues. The first choice was to become a pharmacist. It wasn't my first choice, it was their first choice. So, my first choice, ever since I was a kid, was to become a vet, right? But ever since I remember telling my mom that, she told me, you're not going to become a vet. You're going to be a doctor for people, not for animals. And I'm like, but why? There's too many doctors for people already. Like, animals need us. So, in many ways, that's how my journey to nursing started. My parents strongly encouraged me to get into some form of health sciences. I didn't get into the pharmacy school, so I ended up going to nursing. My mom is a nurse. And it just made sense at the time, I took all the sciences in high school. I was being trained and primed to go to this path of not really a lot of my choice, but I went along and I decided to, so my journey to nursing was not a straight linear path either, because I was not sure about it. I first did a 2-year diploma in George Brown, and then after that, I did a 1-year kind of what it's called a bridging program to bridge into a registered nurse, which is a university degree program. So, so my journey in nursing school was 5 years in total with 3 different schools. I did learn to love it. It wasn't my first choice, and I didn't really know what to expect, except when I was in high school, I did volunteer in nursing homes, and I just loved working with the older adult population. So, I think I didn't really associate, like from pets to like, people. And especially older people, like the older adult, like I just kind of fell in love with them. They're just, but at the time, I was very young. I was 18 and I was just focused on academics because culturally that's kind of what's seen as an accomplishment in society. So I did like what a good, firstborn child would and made their parents proud. And so I went to nursing school and it was tough. I was, imagine 18 years old, still a teenager, waking up at 5 in the morning to take in Toronto, we live in Toronto, we have a Blue Night bus, this bus that just travels off hours, and if you miss it then you have to wait 1 hour. So I remember in the winter, cold nights.
Being on time.
Yeah, 5 a.m. waiting for this bus, shivering, minus who knows what outside. And my trip was 2 hours long across the city, and I needed to take three various types of transportation to get there. And that was really a profound memory. Looking back now, it's like, whoa, like I did that at 18. And then when I got there, I witnessed people in their end of life, you know. I was basically shaving people before I even had any facial hair. And, you know, like I was witnessing the end of life, whereas my peers were beginning their their life. Like I didn't party, or not that I that's not what I I feel like I missed that on, but like yeah, I felt like I didn't have a quote unquote normal like growing up. Yeah, so I spent the rest of my 20s then in the nursing career. And I do love the working in a very intimate way with people. I think nursing does provide that. It's extremely demanding. Like at the time, I was kind of focused on the tasks that I need to do, like building this career and profession, and then somewhere along the lines, I stopped to think, you know, what do I actually want? Because that's what my parents wanted.
Mm-hmm.
And I've learned to like and love what I do because I've learned to just kind of like adapt to the situation and love the things that I love. But there's a lot of things that was really difficult for me, like the shift work was really difficult.
Mm-hmm.
More and more nurses are getting more autonomy, but you know, at the time I felt like nurses get a lot of responsibilities that are not even part of nursing work. You know, like things like cleaning up and emptying trash, and so I felt like a lot of things in other disciplines, because we had to work as a team with occupational therapists, physiotherapists, social
Mm-hmm.
workers, doctors, and I felt nursing carried such a heavy load, and we were always kind of short staffed. Our sleeps were ruined.
Mm-hmm.
Our
Yeah, I've met
diets.
so many nurses who have terrible sleep schedules. Yeah.
Yeah, and after a while, nurses break their back. And this is not to discourage anyone from nursing or, you know, to put down anyone in the profession. I love the nursing career. It's an honorable profession,
Mm-hmm.
and without nurses, I don't know, like, we need nurses more than any other, like, I would say. But for me, like, it was taking a toll in my body, and nursing is such a caring and giving profession that after 10 years, you know, it, I was wondering, like, well, when do I get to give to myself? Because back to the public transportation, I would spend my New Year's Eve in the bus by myself and looking at my time and counting down, like, I need to get home. I won't be there on time, but you know, at least, you know, not having any weekends. And that's my choosing because I didn't have a full-time job. So as a part-time nurse, you kind of have to pick out whatever nobody wants. You know, nobody wants to work on the weekends or holidays, so I took all of them. And so yeah, closer to the end of my 20s, I decided that maybe there's something else out there that's I can balance. You know, maybe I could balance with nursing. Maybe I could balance my life. I just want more time for myself. I want to be able to take care of myself, and I want to explore other aspects of health other than just, you know, the critical, the acute, and what feels like, you know, we're trying, like it's kind of like later on down the line, like what would it be like if we got more involved in prevention and empowering people
Yeah,
rather
it's
than
more reactive to
yeah.
instead of preventative work, I guess.
Yeah, you do get to, depending on what kind of nurse you are, like community health nurses do get to teach people how to take care of themselves. Um, but I feel like there's more work that needs to be done.
So,
When, yeah.
no, sorry, go ahead.
Yeah, with preventative, and what I really mean by preventative is like, because preventative almost sounds like let's not let that happen. So there's still the focus is avoidance, but like really empowerment. Like how can we empower people to make good choices in their and to be informed? Like health literacy in Canada is extremely low, you know. So if people are educated about their own health, then they can make choices, and those healthy choices prevent those chronic diseases. Like I worked with the older population, and the amount of, you know, not one person just has one condition. It's a mixture, and it's a very complex thing because you're having to treat a multiple array of dimensions in this individual, including their spiritual and their family and social health. And sometimes we live in Canada where we rely on a publicly funded system. And as good as it is, we just don't have enough resources to fill all of the needs of the human mind, body, and soul. So I started exploring, you know, I was introduced to meditation when I was 13, so that kind of opened up a path of yoga. And I would go to a yoga studio at downtown Toronto, and underneath the studio is a naturopathic clinic, right? So yoga, naturopathic, you know, that they're around the same genre, you know. When you're from an outside, like, you know, it's, you know, like these are kind of like the new alternative, you know. So I was doing my teacher training, and I got curious. I can't really remember the exact day or what happened, like how did I find naturopathy. I don't know, maybe it was from a book, maybe I was in a bookstore, but I do remember going down there to that clinic, and at the time I didn't have a lot of money, so the only way I could experience it firsthand was offering my time, because I had a lot of time back then. And I told them if I could volunteer. I asked them, can I volunteer in this clinic? And
this was when you were 13?
Oh no, no, 13, no.
Sorry,
This was, I think this must be around like just after I finished my degree in nursing. So I started nursing school at 18, okay, and then 5 years later I finished. So 5 years after that, I know the math, 20 something. Around that time, maybe I was 24 to 26. I was doing the yoga teacher training. I think I did the teacher training in 2014. So I don't know if that dates add up, but my memory. So the point is, I was curious about other forms of healing modalities, and in yoga, one of my favorite forms of yoga is something called yin yoga, which incorporates a lot of traditional Chinese medicine philosophies into it. And so I think the yoga teacher was also a TCM, a traditional Chinese medicine practitioner. And so she would, you know, incorporate that into yoga, and somehow I found my way downstairs to the naturopathic clinic, and I got the volunteer opportunity, and I got to see what a clinic is like, and you know, how they help people and what sort of things they do. And the first thing, I was kind of overwhelmed because although I studied in healthcare, like I didn't really know a lot about, you know, natural health products. Like I didn't know what these supplements are or these remedies are. So I was really intrigued and curious. And I think after a year I decided that, okay, I think, yeah, I could see myself doing. Oh, I do remember one time talking to a patient outside North York General Hospital, which is across our school. And at the time, I wasn't really convinced that I'm in the right place just yet. Like, I can do what I do. I'm a good nurse. Like, I know how to do what I need to do, but something felt like, you know, something was missing. And this gentleman, so I was working in the chemotherapy outpatient clinic, and this person flew airplanes for the army. Like, he was a pilot. And he said, I just absolutely loved my job. I loved my life. I had no regrets. So even now that I have cancer, I'm happy to go. And then that kind of, I was staring out the window at the time. And and he told me that, it looks like you're thinking about something. And I was like, yeah. And then he's like, well, whatever you're thinking about, you should go for it. And at the time, I was looking over at the window
At
across
CCNM?
CCNM.
Oh my
And I
gosh.
think that's when I finally said, after watching YouTube videos of naturopaths and searching, and like, one thing I wish I searched more was the cost. I was going at,
That's
like
one
my
downside.
passion.
Mm-hmm.
But had I been more prepared, then I think it would have been manageable. But it is, an expensive endeavor, but I think it's definitely worth it. And from that day on, yeah, I applied. I somehow got in. This was after, because you need pre-medical sciences to get into our school and a degree. So I had to go back and get my chemistry, all the stuff that I hated, math. So I suffered through it all. Eventually I got it all. I found that was the most difficult part, was just, first and second year with all the, the sciences,
Mm-hmm.
because I felt like I was really, truly, I had an artistic brain, but my parents, encouraged me to the science. I, throughout my life, had to adapt to the situation around me, and I felt like that was the first time that I had a choice, that I wanted to. And so at the time, like, even though I knew it was going to cost a lot of money, I said, and I don't have this money, but I said, you know what, this is something, if it's a big mistake, well, at least it was my mistake. But I don't think that's the case. I love where I am right now.
Hmm.
Yeah.
That's great. Like,
Yeah.
yes. I'm glad. Well, thanks for sharing all of that. Like, I mean, you actually covered a lot of questions already. So I'm like, oh, yeah, okay, you're working through this question. You're working through this question. So let me ask you this. What do you think was like the attractive part of naturopathic medicine to you? Because you were looking at all these YouTube videos and you're like, yes, I think I'm really interested. Like, what was it about those videos that were like,
Yeah. Well, the YouTube videos were mainly done by schools, so
oh.
they were showing, like, the like, any profession you choose, there's gonna be challenges and some good sides. But when they're trying to attract students, their emphasis is on, like, like, they got this guy who's like, I'm married, I got a dog, I have a kid, like, the what is societal kind of like, white picket fence kind of thing. When I was looking, I can't really remember what I saw. I think really the thing that really attracted me to naturopathy was, I think I mentioned earlier, I was interested in empowerment, and I was sensing a lack of it in our traditional healthcare system. So I wanted to get involved. I didn't want to change who I work with, the people. I just wanted to have more tools, and I'm helping people. And I'm also like kind of like a little bit of a nerdy brainiac that likes mental stimulation. So that's why I like the naturopathy work, because you get to do a lot of research, and I love the psychological aspect. Like, I love mental health. So both chronic complex care and mental health was my focus in nursing. And in naturopathy, you got the time to sit with your clients, and you get to know them, and we're not just looking at one symptom. And I was also kind of like, I knew like shift work was very hard for me. I know people, my parents, they both work shift work, and somehow they can do it. Even now they're in their 60s, they're still working. But for me in my 20s, like, if I don't sleep, I don't know what it is. I just cannot train my body not to sleep. So that, for me, like, my health was being compromised while I'm helping others, and I felt like, how can I do that? Like, how can I keep people healthy when I'm not healthy? So at some point I had to prioritize my needs first, which was a very difficult lesson to learn, because I came from a Filipino background, like Asian background, who prioritizes the family over the individual. It's not a good thing or a bad thing, it's just the way it is. And I also am the oldest of 3 siblings, and my younger ones are much younger than me. I think my sister is 14 years younger than me. So I grew up raising my siblings at an early age, you know. So, and then I was trying to meet my parents' expectations and trying to be a good student, trying to be a good
Mhm.
nurse. I was trying to be good for everyone else, but not myself.
Mhm.
And eventually I burnt out. Like, I had all these, you know, anxieties and sleep problems, and I couldn't understand. I tried to distract myself by traveling, using up
Mhm.
all my nursing money, you know. Um, that's how I got into yoga. Like, I was trying to calm my overactive mind. Like, I felt like that gentleman said, something is not right. Like, this was the patient telling the doctor. So I was like, who's sick or who's not sick here? But I think it's important, especially for healthcare providers or any helping person, whether you're a profession or you're a caregiver, it's so vital that you take care of yourself. So I saw naturopathy as a way for me to have that lifestyle that I was
Mhm.
craving for and not compromise, still be able to help people,
Mhm.
but not compromise myself. It's
Mhm.
important to have that balance.
Yes.
So for me, my sleep is so important,
Mhm.
you know. So that's the reason why. And then I looked at the philosophies and principles. I actually love the history of naturopathy,
Mhm.
where these early pioneers were um, opening up, you know, like these, um, I want to call them like retreat centers where people can go in and heal themselves, you know, like they can just take time away from work. And some of these, I forgot what the actual word is because it's such an old word. Oh, do you remember like when Benedict last opened up a sanitarium? That's what it is.
Oh wow.
Yeah, a sanitarium. Sorry, that's what it
That's
was
original
called.
way back.
Yeah, so way back. So
Uh-huh.
I was reading about because I'm kind of like an avid reader and I like to read. So I was reading like the history and I was like, wow, like rather than a hospital, these people have like a healing center.
Yeah, yeah. Mhm.
And I'm really fascinated. There's one in Iceland that I'd like to visit where people just go there for months, take time off work, and like soak in the hot, you know, pools and get like clay, you know, all over them and acupuncture and stuff like that. And I said, I really want to be a part of this medicine of the past, but should be rejuvenated back into the future. Like we should bring this back because the way we're doing things, like a kind of like a factory line system. Like you come in, one problem, we solve the problem, you go out and you come back in the revolving door. It's really exhausting for everyone, for the work, for the staff, for the healthcare workers, for our financial healthcare system, and most importantly for the patients and their families. Because you know, like imagine, you know, like imagine going to your mechanic and then like having to come back next week because it's the same problem. Like, wouldn't that be frustrating, right? But
Mhm.
people, because I find people um, are kind of conditioned not to be empowered with their health, to have their health be on someone's hand, to be a good patient and do what the doctor says. When something goes wrong, they just think something is wrong with them. And then they try this thing that keeps repeating itself. When people, like, you know, when something happens with your phone bill or whatever, people are very quick to advocate for themselves, right? Or a mechanic or whatever, or your plumber or whatever. When something is not right, or your computer, people will say, you know, I'm not getting the service that I paid for, and they will complain. In healthcare, I don't see that often, especially in Canada because it's public, it's free, be grateful for what you have and get out of here. Take your medications.
Mhm.
So
Kinda. Yeah.
I'd like to get people more proactive. And
Mhm.
with the advent of technology, people are now Googling their conditions, which
Mhm.
are kind of nice because they come in with this information and then we can sit together and sift through which information is relevant, which information is accurate. But I like the fact that people are interested and invested in their own health.
Mhm.
Health is such a difficult thing for a lot of people, you know, because it's something that a lot of people don't act on until they feel something is wrong.
Mhm.
And I think that's not the right way to approach it. I think health is like, I think the Buddha said that health is one of the greatest gifts of all. Like, you know, you can have all the money and everything else, but
Mhm.
if your health is is compromised, you're gonna suffer, right? So let's do our best to incorporate this, this concept of living well. Like I even want to move away from the concept of just health and healthcare to like living well, like enjoying your life. And how do you enjoy your life? How do you climb up a steep hike by not having pain in your knees and your back? Like, so if we can focus on how we can enjoy life without, while balancing, like the indulgences and everything and having more involvement in it, I think then we can create like a really good life for a lot of people, and we can prevent a lot of the things from happening, so they don't have to be in the state where, me at 18 years old seeing this person taking 20 medications, and what is it doing, like, not that medications are a bad thing, they're absolutely necessary in most cases. What I'm talking about is including more um, ability for the person to make healthy decisions for themselves, so that we don't have to get to that point.
Yeah, not have to rely on it. Like,
Exactly.
try to work on your diet, work on your lifestyle while you take the medications, and hopefully over time, like the new lifestyle and diet changes will be good enough to like reduce the medications or like just not have as many. Yeah, I agree with everything you said, obviously. Really biased here. That's why I chose naturopathic medicine, was just after shadowing so many medical doctors when I was trying to figure out what I wanted to do, just saw that, what would you call it? They're just coming in and out, getting the revolving door, yes. Getting prescription, coming back because it's not better, and then getting a higher dose of the same thing or adding another thing. But it's not really addressing like what are they doing at home, like how did you get to this spot? So yeah, it's great. Like I want the same thing that you want. I have a question about what did your family and friends, social group, coworkers think of you going from nursing to naturopathic medicine, which isn't so well accepted in society. Did you get any pushback or great encouragement?
Yeah, I think naturopathic medicine today, 2022, is much more accepted. Um, 7 or 6 years ago, when I was trying to enter the profession, I kind of have to keep it hush hush. It was really difficult for me to ask for references because a lot of my nursing professors and colleagues felt that I was kind of betraying them.
Okay.
It's like, so you're leaving the profession? For what? You're gonna do what? Like, what is that? Like, so I, like, I had to be really crafty about how I asked, because you need those kind of references to get into school. And I was kind of like more cognizant of how I spoke about what I want to do, because I was already anticipating their judgment. My family surprisingly supported me, morally supported me. Financially, not so much, but morally supported me through, like, fine, do what you want, right? So it's kind of really relieved that came from them, so it wasn't such a struggle. It was more like explaining to my boss and my previous professors that because they think you're leaving the profession, and I said no, like, I can keep my license active. I can do other nursing type of work. It's just, I think, the shift work and the hospital fast pace is not suitable for someone like me, although I'm capable and I have the knowledge and skills and the judgment to perform in that level. But long term, I need to.
Okay. Go ahead.
Yeah, so as I was saying, I had to explain to them that this is for me to expand my knowledge and my expertise and my ability to help people. And I think after that, because a lot of them at the time didn't really know what naturopathy is, but they know it has something to do with natural stuff. And oftentimes the threat is that, oh, you're gonna get our patients off of medications. It's like, no, it's not that way, right? There's a way to integrate. There's a way to integrate the natural stuff with the pharmaceuticals and everything else, and I think it works better that way anyway. To have a more integrative approach. So this was at the cusp of integrative medicine, and I'm kind of glad I entered the profession at such a time, because when I was volunteering at the clinic, before I even went to school to CCNM, naturopathy was not yet part of the Regulated Health Professions Act. So I'm trying not to age myself, but within the last 7 years, it moved so quickly.
It has.
Our scope keeps growing. So that's why I'm really positive about the direction of our profession, naturopathy, and how it fills in the gaps in healthcare that I've pointed out earlier on. It's such a perfect poise, because we don't have that amount of money to sustain the growing needs of not only an aging Canadian population, but a growing immigration population, right? So we have to be really resourceful in how we manage the current resources, because the budget doesn't get bigger for that, but the needs are. So then how can we be creative in how we approach some of our problems? And one way to do that is to prevent the problems from happening, so we don't have to spend money on them. And it's amazing how much money we can save when people are taking care of themselves. It kind of goes back to what I was saying. I needed to take care of myself first before I could take care of anyone. So every one of us just did that, then nobody will need taken care of. We'll all lose our jobs.
That's the goal, I guess. We're all gonna be unemployed. So it'll take time, though.
So I hope that kind of like hones in like the importance of giving people the power back to their own health. Like that is just the main thing, that I keep emphasizing. Yeah.
So tell me about so you decided to go to naturopathic medical school. You got those reference letters, got your family on board. When you got into school, the Canadian College of Naturopathic Medicine, what did you find there? Like, was naturopathic medical school everything that you expected?
Well, just like any relationship, right? Like in the beginning, you wear rose-colored glasses because you saw all the nice ads on YouTube from all the schools, and you got all these letters and all these booklets from them, and you're excited. It's like, like for me, I felt like I was a big fan of Harry Potter. I don't know if you are, but I grew up with Harry. I felt like I was going to Hogwarts, like going into the school, and so I was very excited, and then reality came in.
What was that reality?
I do remember like a very important memory with CCNM was we had this, which I don't think any school does, where they kind of like bring all the students together and put them in a place for a weekend.
Oh.
What do you call this? Kind of like
It was like a get to know you, like icebreaker type camp thing.
Yeah, but it's a camp. Like it's like a summer camp, right? Like, and most of those kind of things are just done in class or whatever, or even if it is. Like I went to a big university, so that was not done. But this was a kind of like an activity where you get to know each other and you get to ride horses and play games. So I never had a chance to attend any summer camps growing up because my family immigrated here. We didn't have a lot of money. So that was my first time like having fun, like, like with my classmates, and it's like, whoa, like this is so interesting. Like so some of those people I bonded really well with and are still friends, but that was a really nice entryway. It's not like stressful, like it then later became stressful because there's a lot of work. Naturopathic medical school is intense. You know, I remember having to do 12 courses per semester. And I just want to say, 12 courses. Most universities, even medical schools, they have 5 to 6 courses per semester. Right? So imagine we're having to write 12 different exams for your midterms in 1 week, right? We don't have 12 days in a week. We have 5 working days in a week. So then how do you write that? So they're written, that means you're going to have to write more than one exam in a day, sometimes 2, sometimes 3.
That was miserable time.
Yeah, the lecture hours, were up to 10 hours a day. It was a lot of courses packed into one. So I didn't expect that. Uh, I don't think anyone can prepare themselves for that. Like, no matter what degree you had before or experience, because even a lot of medical doctors that become naturopathic doctors are still shocked by the amount of work that we have to do, because we have to learn the basic sciences that medical doctors have to learn, the biochemistry, the biology, like, um, I
Physiology, all that stuff.
all that jazz, right? And then on top of it, we gotta learn stuff that individual professions have to specialize in.
We have like massage, we have chiropractic,
Acupuncture,
right.
hydrotherapy, nutrition, botanical medicine. So, there are herbalists who just specifically focuses on the botany. There's traditional Chinese medicine practitioner who just focuses on TCM. So we had kind of like, it's like if you've ever gone to a buffet and you were so intrigued with everything out there that you just had to put everything on your plate.
Yes.
I think whoever made the decision to create the curriculums was just like, I need one of this, I want to need one of this, but our plate is only so big, right? So you're having to like sit down and basically eat all this food. And it was really hard to switch your palate from something very sour to something very salty. Like, so TCM, traditional Chinese medicine, requires a different way of thinking from homeopathy, from biochemistry, from physiology, from anatomy. So we're like, for someone like me who doesn't like to multitask, it was a real challenge the first 2 years. 12 courses, so I had to switch part-time because I said, my older brain doesn't work like this, and I'm not like the young people that just came straight from their university degree. I was working at the same time, and it was very hard for me to juggle everything. So I made the decision to take part-time, to take, eventually it became a 6-year long journey. And I think that really shaped me, because throughout that 6 years, rather than doing it in 4 years, I was able to get experiences that I wouldn't have otherwise had, and I was able to mature and, I guess, ferment all of that knowledge, and now it's coming to be useful. Like, for example, I got to go to China and do an externship there, and in China it's very cool because certain hospitals there have the integrative model, where they have the traditional Chinese medicine with the conventional medicine, and it's really fun to see how it works together. So people in the hospitals are getting their herbs, their cupping, their moxibustion, their acupuncture all in one place, and they're getting their medications. Nobody's making a big fuss about it. It's just, we work together. And I love that. And they had I was really impressed with no wait times. You got your scans, you got your diagnosis, like they were very efficient. And I saw like, wow, like the potential. China was very progressive in their healthcare. I believe, I've never been to Taiwan, but I think Taiwan and Japan, like, I don't know if they integrate similar systems, but seeing it hand on hand, like the two systems melding in together, I said, North America has a long way to go. We're almost kind of like baby, like when it comes to the integrative medicine piece. Because they had all the practitioners working, even in India. Homeopathy is integrated really well. Like the Ayurveda and yoga is integrated well into the healthcare system. So I think, we have a lot to learn from other people in other countries and how they manage their health. And I think, we need to learn from how we can incorporate more of that. And so I think, naturopathy is an amazing gateway, to be pioneering this incredible, massive change in our society. Yeah. it's a lot of.
Circling back to what we were saying at the very beginning of this talk is like, yeah, there's a lot of weight on our shoulders when you say like naturopathic doctor. It's not just taking care of one individual patient or, you know, many patients in a clinic. It's like we're here to try to transform medicine in this country to make it more integrative, and like it's still new, still almost accepted. Like I wouldn't say we are becoming more accepted, but we're not fully there. Yeah, there's just a lot involved in this profession, right? The schooling, and then registering that you're going through, and then seeing patients, and then just that big picture of transforming medicine. It's a lot, but good.
Yeah, it's really exciting to be a part of that change. You know, you feel almost like an activist, like you're representing something that you really believe in. And that's one thing that I love, is that, you know, it represents who I am. This is a choice that I made. It goes with my values and my philosophies. And I think if you can find something, it doesn't have to be naturopathy. It could be, I don't know, you can be the most amazing nail artist, and that's what you love, and you just, you know, you put your heart and soul into it. Then, like, you know, that creates so much peace and happiness. Just like that person that I spoke to who was a pilot.
Yeah.
And just living a life like that already gives you, like, so much. It gives you so much freedom, and just like getting away from like the stress of not being in the right place. That prevents a lot of health problems from happening, because a lot of my anxiety and depression was coming from
work,
doing things that I didn't want to do for others to make others happy. But what about my happiness? Right? So it's very important to give the choice back to people.
Yeah.
So yeah.
It's all true. Let me ask you this question here. What are things in ND school what are the things that you learned in naturopathic school that you weren't taught in nursing school, and what did you learn in nursing school that you were not taught in ND school?
That's a really common question that I get, because you know, people like to compare things. So nursing school has similarities and differences with naturopathic medical school. So earlier I talked about, like, I wasn't educated in the natural health. Like, we were taught to do research in nursing and to kind of analyze whether or not something is safe for an individual, like especially natural substance is safe. That's as much as we were taught. You know, we weren't encouraged to promote it. We were just there to assess whether or not this person is going to interact with medication. So the emphasis with nursing is safety, and nursing school was also very practical. It was very pragmatic. As I said, at the age of 18, first semester, I was already beside the patients in their bed, you know. Not that way.
By their bed.
By their bed. Sorry. English is my second language. I meant, yeah, I was at the bedside. Naturopathy required more theory before you can go into practice, whereas nursing is almost the opposite. You learn on the spot. You know, there wasn't a lot of emphasis in, for example, immunology was not a course that I was required to take. Even biochemistry, you know. So that's why people are like, you struggled, you should, you know, be acing. I was like, no, I never taken these courses before. You know, I did anatomy, but not to this level, right? Just what I needed for what was needed for your tasks, right? So the emphasis was how to give injections, how to assess for changing health conditions, and so it's we had a course in naturopathic medicine called clinical medicine, right? Where we more focus on physiology and pathology. So that's the emphasis of nursing, is how to be effective on the job. And that shocked me when I went to naturopathic school, because naturopathic school contained a lot of theoretical knowledge. And sometimes I'm like scratching my head, I'm like, do we need this? Like, why are we like shoving like? Am I gonna really need to know the ligament between this joint and that joint? Like, and there was a lot of memorization. So that's where I struggled because I've already kind of been out in the workforce, and I was kind of like, is this really useful, or is it just like more like occupying stuff in my, and for some people who will focus on like hand,
They should know that part, right?
they should know that, but for
Mhm.
me, I kind of knew where I wanted to go to, so I struggled with, like, if I didn't like something, I didn't want to learn it, but I knew I had to. So it was a lot of information in naturopathy. It was a lot. Like, it was crazy. It was a lot. It was a lot. Like, I was losing my mind. Like, and that's why I had to go part time.
In a good way. But yes,
Yeah,
it was
like,
very overwhelming.
yeah. If you like that kind of intellectual stimulation, because you get a little bit of both, and I saw like massive shifts inside of me of who I am as a person, like, because I came from nursing, and I kind of came in with a bias with certain modalities that we use in naturopathy. For example, like, I was very evidence-based when I came to the program, and only entertained evidence-based therapies. So things like traditional Chinese medicine, and especially homeopathy, was a struggle for me, because I was like, what is this nonsense? Like, a bunch of diluted, pills. And throughout time, I've come to appreciate the efficacy of something that is not evidence-based, but clinically useful and effective, that is very difficult to measure in a randomized controlled trial, because it's so individualized.
Yes.
So that really broadened my perspective, and now I would say that homeopathy is actually my top tool that I use, because I work with a lot of people whose main concern are the emotional health, right? And more we're finding out that medications don't penetrate in terms of their efficacy with that, because there's so many factors that are going on, right? Like, even in a complex physical healthcare situation, like, medication is designed for one purpose. Yes, it can be used off-label for other things, but normally, it's designed to treat a certain condition, right? This is where plants differ. When we use botanical medicine, we can use it for a condition, but because the constituency and the molecules, there's so many things going on, there's so many medicinal aspects of a plant, it interacts differently. There's more dimensions to it. So it can be used for this condition, and it also can be used for this condition, because it has these properties. In a very similar way, when we start moving into the more esoteric practices of naturopathy, like traditional Chinese medicine, which requires individualization, a separate tongue and pulse diagnosis, and even more so in homeopathy, where it's like very, very individualized. You cannot give the same two medicines to the same two people, although they are showing up with the same thing, with the same symptoms, because you have to integrate everything. Why are they there? What are the things that are important to them? Two people with a sprained ankle, one is an athlete, one is an office worker. Of course, the athlete's going to be devastated more, because that person depends on that ankle for work, for income, whereas the other person doesn't. So that changes their entire relationship with their health and the disease. So that's what I really appreciate about naturopathy, is it's very versatile and very flexible with the tools that we have available to us. So every naturopath is different. So it's important, like, if you are interested in seeing a naturopath, to shop around, because the first one might not be may not
suit you, like,
click. Yeah, exactly. And because everybody practices in a different way. I know naturopaths who never use homeopathy, who doesn't want anything to do with it, and just, it's just not their thing, and that's totally okay. Some of them, they use strictly nutraceuticals. Some of them use a lot of IVs. It depends, what they're treating and what their focus is on. Because for something like cancer, you would use more IVs than other modalities. So it depends what line of work they're in. So yeah.
Yes. And what what do you see in your future as a naturopathic doctor? What route do you want to go down? So mainly a homeopathy route, or like not specialized, but specifically focus on using that tool, or do you want to do acupuncture? It was difficult to come around to it, but have you come around to acupuncture? What do you want to use mostly in your practice?
Yeah, so in terms of what I want to use, it's more like who do I want to, like, what type of health concerns do I want to work with, as opposed to because the tools can be used, whatever tools is given that is best suitable for the person is what the tool we should use, not because we like it better than the other one, right? So it's good to have all these tools. But what, as I said earlier, you'll notice that certain health concerns require more of certain tools. So for example, if somebody has like bloating, we're gonna focus on their diet, right? Like, why are we gonna give them things right away when we don't even know what they're eating? You know, we're gonna have to investigate it, and maybe we're gonna start by changing their diet. So it depends what the concern is. So the concern for me that I'm mainly interested in is both mental health and healthy aging. I think those two are needed in our country. Those two are lacking, and those two are like one of the most prominent issues we have in our society. So I'd like to focus on those. So so if I'm dealing with mental health, it requires a lot of investigation of that human experience. So homeopathy is suited well, because homeopathy, you just sit and do what you're doing right now, nodding, and it seems like it's nothing, but that gives the person the space to be able to express their full authentic self without judgment, and that's very healing on its own.
It is.
Right? So I'm not going to use, like, for someone who is having emotional issues, like, I don't want to just give them, you know, the fish oils and the St. John's wort, which we know is effective in a clinical sense, but I don't really see that being very different from giving an SSRI, right? Because if we haven't explored the full, you know, reasoning behind, you know, their situation as to why are they suffering in this way, then we haven't done our job. So we have to use the tool that best fits the situation, right? So if I'm with an older individual, maybe 78 years old, who have a heart condition and also have an arthritic condition and a back pain condition, well, I know for back pain, maybe acupuncture is a lot better, as it's been shown by evidence. So we have to use what's available in theory, in evidence, and what we know to be clinically relevant, regardless of evidence, because we know them to be effective. They've been used for TCM, traditional Chinese medicine. It's been around for thousands of years. So, and they continue to be used, and they continue to be effective. So that's my approach to it. It's not so much which tool I want to use, it's, you know, which tool is appropriate and which conditions I'm interested in, because there's certain conditions that are just beyond me. Like, for example, cancer care. You know, I can do it. It's very difficult for me to do it because there's a lot of emotions. It's not for someone like me. You know, I was working in a chemo clinic, as I said earlier, as a nurse, and it was very difficult for me to sit and watch people feel helpless and confused whether or not they're gonna live or not, especially the little ones that are very young. It was very hard for me to work in that environment. So I know for me, like, where my boundaries are, like what, you know, what health concerns I want to work with, and what health concerns I'd rather have someone who is proficient and effective in there to do that job, because they do so much better than me. So
I have a question that I don't necessarily need the answer to, because I think I know the answer, but for the audience who's watching, like, why is homeopathy the tool for mental, emotional health?
Yeah, so when we say why is it the tool, it's not the only tool.
Well, not the only tool,
It's
but
not the
like,
only tool.
why is it a useful one?
Yeah. So first, I think it's important to have a better understanding of what we mean by emotional health concerns and what is homeopathy to begin with, right? So if we can define those two concepts, then I think we can understand why they make such a good pair. So I worked primarily in mental health and complex chronic care. So already I have that experience from nursing, 10 years of working there. So I got to see the gaps, which I've kind of iterated earlier. And I was searching for it in the current system, and the current system is heavily pharmaceutically based, right? So pharmaceuticals and surgery works incredibly well in the emergency room. In the ICU, I wouldn't use homeopathy. Are you crazy? Like, somebody is anaphylactic? No, give them an EpiPen.
Yeah.
Pharmaceuticals, please, don't give me this nonsense. However, we're very new in discovering that mental and emotional problems is not solely isolated in the mind and in the brain. I think a recent study showed that SSRIs are no better than a placebo, right? This is a big study that was released. So if that's the case, so that for decades we've been just giving Prozac to everyone, like a what do you call it? Tic-tac? Yeah, and now we're finding out, oh, okay, well, you could have just given anything. Not that homeopathy is a placebo. Homeopathy is not a placebo. It's quite different. Homeopathy is a medicine that is very complex. There's psychological aspects. You have to learn how to listen. And you have to learn how to allow someone to tap into what is called their uncompensated state, the state that they are most naturally in, that they often hide because they can't show it. Like when you go to the coffee shop and the barista asks you, how's your day today? You say, I'm well, thank you. How about you? Even though inside you're in a living hell. You cannot go to that barista and say, well, actually, I'm going through a divorce. My kid is diagnosed with autism. I have a aging grandmother that I'm taking care of, and I'm balancing 3 jobs. That's not socially acceptable, Where is that acceptable? Not even in our families. There's a lot of shame, right? And so I explored, psychotherapy. As myself, with my own issues with anxiety and depression. And it wasn't until I came across homeopathy, which I absolutely was against in the beginning, but I had no more choice. I was really suicidal, and I was like, whatever, just try it. What can I, and what had happened was what psychologists called unconditional positive regard. Carl Rogers coined this. In homeopathy, that's what happens. You allow this person to be fully who they are, warts and all. And there's this magical thing that happens. Now, this can happen not just in homeopathy, this can happen with a really good psychotherapist or a psychologist or any practitioner out there that has the skill to be able to handle the energies and the emotion of that person that's presenting. Because you also don't want to be in a mix of that mess, because then you're not effective anymore. Remember, you got to take care of yourself first. Put your own oxygen mask first. Homeopathy allows that, because if naturopathic consultation is 1 hour, homeopathy can go for 3 hours.
Yeah, so that's something I think that the audience doesn't really, may not know if you're just discovering naturopathic medicine and wanting to know more about each modality like homeopathy. I think that people need to know that homeopathy isn't just about taking the white pearly pill. It's it's the whole really long process of figuring out which white pearly pill you give, and that whole process I think in itself is supremely healing, because you ask so many questions of the patient, this about your life, from your earliest memory to present time. You get to know the person deeply, and that whole process takes many hours. I remember doing an intake for a patient. It was 6 hours or something.
That's not uncommon.
It's a lot of charting too.
And then you have to go back and do your research. Usually 10 hours is the average once you're good.
extremely individualized.
It's extremely detailed, which is
Mhm.
something that separates homeopathy from other type of talk therapy, because homeopathy is not a talk therapy. It's a form of energetic medicine. Um, and it's really hard to describe, and the only way to know it is to experience it. Go with an open mind, have your doubts, have your questions.
Be a
Go in.
skeptic, go in,
Yeah,
see what
just
it's like.
just like me. Just like me, because homeopathy, as you said, is very concerned about getting to know you, your peculiarities, what we call strange or peculiar symptoms. Things like, do you sleep with your covers covering your toes, or do you like to have your feet exposed? Do you
Yeah, small details like that.
exactly, do you like to drink warm water in the morning, and when you do you feel ill after? Like, do you like to sleep with the window slightly ajar, open, so that you can get the fresh, cool wind? And if you do, we want to know what about it that
What
makes
do you
it.
like about it?
Exactly, because every individual has a different reason. So for someone who likes the window open, well, they may be feeling hot, right? Like a sulfur, very hot remedy. They want the air in. But pulsatilla loves that too, right? Because they like fresh open air. So they want two different people want two different things, but they're doing the same thing. And that's why I love homeopathy. Because, the same
Get to
thing.
know those nitty
Nitty
gritty details.
Two people with an ankle injury, as I said, have two reasons why this is causing them suffering. And then eventually, oh my gosh, like magic happens, because all of a sudden they just start fixing their own problems. You give them a remedy, and then you just leave them, and it's like putting something in the oven, and then bing, and then it's like you check, and it's like, oh, I think it's ready. It may take a few months, but then they start healing themselves, not just their mental and emotional, but it's so intricately linked to the physical symptoms. The back pain, the skin problems, the digestive issues start beginning to dissipate. It's almost like it's evaporating. It's a slow process, but that's why I love it. You don't see, sometimes you do see the results right away. There are cases where it's immediate. It's an acute case, you give it. But I really love the long process, because you develop such a different relationship with, this person has trusted you with information not even their husbands, not even their mothers know. Like, you literally know that they have a birthmark, like, in a place in their body that nobody else knows. So, it's really rewarding. I'm really passionate when I talk about it. And I haven't, I wouldn't have fallen in love with homeopathy had I not stayed in the school for 6 years, because it needed time for me to be able to accept these weird concepts. But when I got past through that, and saw the result for myself and from my
Other
patients
people.
and other people, I started like, whoa, like I haven't seen this. I worked in mental health like for almost 10 years, and I haven't seen this, like when I was in psychotherapy, when I was, you know, like try different things. So for me, it made sense. Not for everyone, but for me, it did. So I think the best way to figure out whether or not something is for you or not is to try it. Go try acupuncture. That may be your thing. I love hydrotherapy. Hydrotherapy is my thing. I could spend hours in water. I just like love it. Some people hate it. They don't like getting wet. They're like a cat, right? So that's why it's beautiful with naturopathy that you have so many options available, and that's right, like matching what fits for that individual. Yeah.
I think that's like everything you just said about like everything that you just said is very important. I think for people to hear because about homeopathy, because the automatic assumption is, oh, it's not evidence based. It's just a sugar pill, and anyone who takes it is just completely hoo-ha, like, whatever. But you're someone who has tried all those conventional things 1st. You've done it all almost, right? And you've seen it in practice as a nurse, and like in your 10 years of experience before, like diving into homeopathy, like you know what to expect from those particular treatments, and then you see what a naturopathic modality does, like homeopathy, what it can do, and it's like, oh wow, like this isn't an option. It is an option. It's not just the hoo-ha that everyone just automatically thinks it is. It isn't for everybody, of course, and for many people, like the like just counseling or the SSRI or um, journaling is enough. But like if someone has tried all those things and it's not effective, like let's give homeopathy a try. See if it's working. It's gonna work for you.
And homeopathy is one of our most gentlest modalities. You know,
And
sometimes
cost effective too.
oh, very cost effective. Like like the little
it's like $7.
Exactly. Like homeopathy does stir things. Anytime you work on yourself, you're bound to stir something. So we call that a mild aggravation. Is kind of what we're going for, because then it's like opening. You shoved everything in the closet and hoping you'll never see it again. Homeopathy asks you to take a peek, and when you're ready, slowly open it. And when you're ready, slowly take things out. Slowly open the boxes, slowly pick an item up, slowly ask yourself, do I still need this? Or does this have to go? And if it has to go, there's a mourning process of letting go. Homeopathy asks you to do a very difficult thing. A lot of the things is just like, keep it shut, don't look at it, distract yourself. I work with a lot of people in addictions, and that's one of the recommendations is that if you're having a craving, distract yourself. Try to get your attention out of that craving. But let's pause for a second. If you distract yourself and don't ask yourself, well, where is this craving coming from? Craving means you're wanting something that you're lacking. It may be alcohol that can fill that void momentarily. It could be drugs. It could be video games. I don't know, shopping, whatever. If we don't ask ourselves, why am I feeling this way? What's missing? We'll try to fill it with things that are momentarily effective, but in the long term doesn't provide, in homeopathy, the cure, what it's called. It doesn't provide the solution. Homeopathy asks you to pause, and that's why the consultations are so long.
Mm-hmm.
To look in the mirror, to look in that closet that you've stuffed all that skeleton, to slowly and gently take them out and work with them one by one on your own with the homeopath or naturopathic doctors, holding your hand. But essentially, a lot of the work is done by you, and that's why we only require that pellet. That pellet kind of activates that energetic essence, if you may. Like it is a match of what you are experiencing right now, and it just helps that process go smoother. The main work is you. That's why it's not uncommon for homeopaths not to see you after 3 months. You deal with your stuff, you come back to me when you've done your homework. It's not up to me to solve your problem. Very different way of thinking when you go to a doctor. Doctor, I have a problem. What's the solution? Give me a medication. Take it. If we look at homeopathy that way, we're not doing it properly. Because homeopathy is not a medication, right? It's a different form of medicine.
It's a whole experience, yeah. Mm-hmm.
Yeah. It's like the medicine comes from you. You do the work. You gotta. But that's why the homeopath or the naturopathic doctor is there to help assist that, because they will know when the remedy is working. Okay, you're experiencing this turbulence as expected because we just opened this little box that contained all of the traumatic childhood experiences.
Mm-hmm.
So it's expected to feel a little uneasy. And there's ways we can work through that, right? And then we can consider, do we close it and put it back, look at it again later, or maybe it's time to let it go.
Mm-hmm.
So
I don't personally do homeopathy because it is just so involved.
It's intensive.
It is very, very involved. So I'm glad that you love it and you're super passionate about it. And if you are interested in experiencing homeopathy, you need to seek this.
Come to Nova
Hiraya
Scotia.
Right away.
Well, once I have my license and once I have my
Right,
clinic
yes,
in
yes.
Nova Scotia, then
Exactly.
come spend some time by the seaside in the East Coast. It's just so nice over there.
You gotta like carve out 8 hours of your time to do it, but it's gonna be worth it.
Exactly.
Let me look at my list of questions and see what have we not covered yet. Well, I think that's a lot of stuff has been covered actually. Thank you for sharing so much about your life, your experience, your passion about homeopathy, your journey. How can people reach you and
Oh yes.
find you?
It would be nice to get in touch with all of you if you would like. So I have a YouTube channel. Okay, I have a YouTube channel that's kind of designed to give people a little bit of an online experience of what it would be like to visit naturopathic doctors and other integrative healthcare practitioners. So either film myself receiving the treatment or me giving treatment, and there's this concept of ASMR. Like I think it's kind of been kind of sweeping through YouTube. So I found that's a way for people to get introduced into some of our modalities. So they may not know what acupuncture is or they've heard about it, but being able to witness it. So I have a YouTube channel, Hiraya. You can Google YouTube Hiraya. Sorry, you could search Hiraya Hiraya ASMR or Health and Wellness. You'll find me. I'm everywhere there in the algorithm. I also have a podcast called Timeless Mind, Body, and Soul, where we have more kind of like conversations about health, kind of similar to this. So it's not so much kind of like like a kind of like, what do you call that? ASMR is more like an immersive experience.
Mm-hmm.
The podcast is more for educational purposes. And I'm currently working on my website. I don't know yet the domain, but eventually you can Google me, Hiraya, Health and Wellness, or Hiraya ASMR. And on my website, there will be a newsletter. There will be a sign up for a newsletter, and it's free. And I really love writing. So I love writing to the people, to my audience. And that's the most personal way it can get, because I write to people, and then they get to kind of share more with them rather than just the public platforms. So in a couple of weeks time, the website will be ready. Still deciding on the domain, so it's either going to be Hiraya Health and Wellness or just Hiraya SMR.
Whenever it's ready, it will be in the description.
Exactly. That makes life so much easier. Yeah, just wait for the description to upload and I'll be there. So thank you so much for having me.
Thank you so much. Thank you for watching and listening. And that's the end of the talk.
Thank you, everyone.
And hopefully maybe we can have a bigger discussion about homeopathy, because you are so passionate about it. I see you like almost leaping out of your seat to talk about it. So if you are interested in knowing more about homeopathy, then put it in the comments. If you're not like a fan of homeopathy, you can write down why, respectfully. But just to create conversation in the comments, and just want to hear your feedback on what your thoughts on homeopathy is, and just like the experience that Hiraya has had from going from nursing to naturopathic medicine. Are you on that particular journey yourself? Let me know, let us know, so that we can tailor videos in the future to answer your questions or address whatever you bring up down there. All right, thank you so much for watching, and I'll see you in the next video. Bye-bye. Okay.
Yay.
Good job. Good job.
Perfect. Okay,
Holy-
let's
Holy
pause
cows.
this.